You already know that breast and cervical cancer are the major cancers among women throughout Africa and throughout most of the world, in fact. And together, what you might not know in terms of numbers is that together they kill 500,000 more women each year, more than deaths due to pregnancy and childbirth complications. And we're going to be promoting this in a key message of an upcoming series I am leading for the journal The Lancet. So keep your eyes peeled for that. Health, Equity, and Women's Cancers, a Lancet series coming in perhaps January 2016. So early diagnosis versus screening. I draw attention to this because the WHO does have a clear definition of each of these and what they are and what they are not. And often we use these words interchangeably. So I would kind of suggest to you today that we should be careful with our language and how we frame each of these, because it will have an impact on what we advise our ministries, for example, or what we tell our perhaps interested donors of what we really would like them to fund. Early diagnosis refers to diagnosis of cancer when it's easier to treat, usually which means an earlier stage of disease. So a breast cancer that's this big, that hasn't spread to the lymph nodes, can have a 90% chance of cure, provided you can give proper surgery, access to good pathology, and you can get back to the patient and tell her what that is and whether or not she needs extra treatment, such as tamoxifen, a cheap drug generically available through most of the world with low toxicity. That is a good approach to breast cancer treatment. Organized screening, on the other hand, is inviting at-risk women with no symptoms for a test such as VIA that tells them whether they're at high risk or low risk for cancer, for which there needs to be either same-day treatment, as we know is very effective, especially where you don't have access to further diagnostic interventions like a colposcopy and biopsy, okay? But the problem with screening in this sense, and we talk about mammogram screening in high-income countries, for example, is that it requires tremendous infrastructure.